The REFLECT trial was the phase 3 open-label trial of lenvatinib versus sorafenib for frontline therapy of advanced HCC, either metastatic disease, vascular invasion. It enrolled patients with good performance status, ECOG 0 to 2, and good Child-Pugh status, meaning Child-Pugh A, into a really open-label randomization of lenvatinib versus sorafenib. It was powered as a non-inferiority trial, and then it also had secondary endpoints of response rates, overall survival, progression-free survival, and the standard treatments things that we think about when we're looking at different treatments. So for the REFLECT trial, this was a positive trial, meaning that lenvatinib was proven to be non-inferior to sorafenib as far as overall survival. The overall survival in patients in the lenvatinib group was 13.6 months, and in the sorafenib group was 12.3 months, and that hazard ratio was 0.92. So statistically, these two therapies were equivalent or non-inferior for overall survival with these patients. Now, it's important to realize that the sorafenib group did have a longer overall survival as compared to, say, the SHARP trial or the Asia-Pacific trial, where sorafenib was initially approved with first-line therapy. But the inclusion criteria for the REFLECT trial was very different in that patients who had main portal vein invasion were excluded from the trial. They also excluded patients that had a greater than 50% tumor burden in the liver. What that means is that patients with very advanced liver cancer were actually excluded from the REFLECT trial, and that then accounts for why the overall survival potentially could have been longer as compared to registration trials before this trial. The other thing with the REFLECT trial to realize is even though overall survival was the same, lenvatinib actually was shown to have a better overall response rate as compared to sorafenib. Lenvatinib's overall response rate was 24.1% as compared to sorafenib, where the overall response rate was 9%. This was by a modified RECIST criteria, which is really the criteria that we use generally for patients with liver cancer as opposed to other cancers that use the RECIST 1.1. The progression-free survival and time to progression was also better with lenvatinib as compared to sorafenib. So lenvatinib's progression-free survival was 7.4 months compared to sorafenib, where it was 3.7 months. And the time to progression was 8.9 months compared to 3.7 months. And these were both statistically significant. So overall survival was equivalent. However, response rates, progression-free survival, and time to progression all were better with lenvatinib. The REFLECT trial then led to FDA approval for lenvatinib for first-line treatment of advanced hepatocellular carcinoma. And with the REFLECT trial and the subsequent FDA approval, that then offers lenvatinib as an additional standard of care to sorafenib that we've had for the past 10 years. I think that lenvatinib is a very good option for patients who are symptomatic, or potentially patients that we need to stabilize their disease for longer periods of time. And there's also some discussion that potentially with the response rate of lenvatinib, if the patients do benefit from lenvatinib with tumor shrinkage, that may then be able to get them into a place where they could potentially undergo local regional therapy or surgical treatments. We have to remember that lenvatinib did have more hypertension than sorafenib in the REFLECT trial. So we have to remember that our patients who already have difficult to control hypertension or poorly controlled hypertension, this may be a reason that we want to choose sorafenib over lenvatinib. So lenvatinib did have more hypertension than sorafenib in the REFLECT trial. So for patients who have poorly controlled blood pressure or uncontrolled blood pressure, we may want to think about sorafenib instead of lenvatinib. But really at this point, I think both therapies should be considered standard of care. In the REFLECT trials, the sorafenib-treated patients did have a longer survival of 12.3 months compared to what we expected from the SHARP trial, which was 10.7 months. We think that this is probably because the patients in the REFLECT trial, again, were not allowed to have main portal vein invasion, and they also were not allowed to have more than 50% of their liver involved. These two criteria were not part of the inclusion criteria for SHARP, and so the patients with SHARP actually had a little bit more advanced liver cancer, which I think caused the change in the median survival that we saw between those two different trials.